Today, we're diving into a fascinating medical puzzle. How do you stop bleeding? We're going to look at two drugs that on the surface seem to do the same thing, but as you'll see, they tackle the problem from completely opposite angles.
You know, it's a question we've all had at some point. You get a tiny paper cut, and you think, is this ever going to stop? But it always does, and that's because our bodies have this incredible built-in emergency response system. Understanding that system is the key to unlocking how our two drugs work.
So let's do a quick breakdown of how your body slams on the brakes when there's an injury. It's a beautifully coordinated process called hemostasis.
Okay, so first thing that happens, the blood vessel itself actually squeezes shut to slow down the flow. Then, these tiny cells called platelets rush to the scene and form a temporary plug, kind of like sticking your finger in a leaking dam. And finally, a protein called fibrin weaves this super strong mesh over the plug, creating a really stable clot. It's basically the body's own all-in-one superglue and gauze patch.
And you think, okay, clot formed, problem solved. But, the body is all about balance. So just like it has a system to build clots, it also has a cleanup crew to break them down once everything is healed. The issue is, sometimes that cleanup crew gets a little overeager and starts tearing down the clot before the job is actually done.
And that brings us to our first hero, tranexamic acid, or TXA for short. Now, its job isn't to build the clot. Its job is to protect the one that's already there. Think of it less like a construction worker and more like a security guard. The fancy scientific name for what TXA does is anti-fibrinolytic. It sounds complicated, but let's break it down. Anti means against, and fibrinolytic means the breakdown of fibrin. So it literally works against the breakdown of that fibrin clot. Simple as that.
So how does it actually do that? Well, imagine your body has these natural little molecular scissors that are designed to cut up clots. TXA works by basically putting a safety cap on those scissors. It blocks the enzyme that activates them. So the crucial takeaway here is this: TXA doesn't create anything new, it just shields the amazing clot your body already built.
Okay, but that raises a whole different question. What if the clot is perfectly stable, but that's not the problem? What if the issue is that the blood vessels themselves, the tiny little capillaries, are just weak and leaky? A strong clot isn't going to do much good if the walls of the pipe are compromised to begin with.
And that is the perfect cue for our second hero, ethamsylate. If TXA is the clot shield, you can think of ethamsylate as the vessel wall strengthener. It's working on a completely different part of the problem.
Ethamsylate falls into a broader category called hemostatic agents. The end goal is the same, stop the bleeding, but its whole strategy is focused on those very first steps of the process, strengthening the blood vessels and helping out the platelets.
So, ethamsylate has a really cool two-pronged attack. First, it physically increases the resistance of the capillary walls, making them tougher and less leaky. And second, it makes platelets stickier, helping them clump together and form that crucial first plug way more effectively. It's all about reinforcing the body's first line of defense.
And you can really see the difference here. Before, you've got these weak, porous capillaries just letting blood seep out. But after ethamsylate comes in, that integrity is restored. It's like you're fixing a leaky garden hose from the inside instead of just trying to put a bucket under the drip.
Okay, so we have two totally different strategies, the clot shield versus the vessel wall strengthener. To see how they actually stack up against each other in the real world, let's take a look at some data.
This table just lays it all out so clearly. You've got TXA, the antifibrinolytic, our clot shield. It's best for when the main issue is that clots are breaking down too fast. Then you've got ethamsylate, the hemostatic, our vessel strengthener. It's perfect for when the bleeding is coming from fragile capillaries. Two different tools for two very different jobs.
So to see how they actually perform, a 2017 study put them head-to-head in treating heavy menstrual bleeding, which is a condition that can really impact a person's quality of life.
So the results were measured with something called the MIQ score, which is basically just a way of rating the improvement in quality of life. Now, both drugs definitely helped, but the data shows a clear winner in this particular race. Patients using tranexamic acid reported a bigger improvement, with a score of 21 compared to 17 for ethamsylate. So in this case, protecting the clot turned out to be the more effective strategy.
So, TXA wins, right? End of story. Well, not so fast, because this is where the story gets really, really interesting. It turns out this isn't about picking one against the other. It's about what happens when you put them on the same team. A 2021 study looked at this in a really high-stakes scenario, pediatric cardiac surgery.
where bleeding risk is obviously a huge concern, and their conclusion was just unambiguous. Using the two drugs together was way more effective than using TXA all by itself. And just look at this data. It is absolutely stunning. The control group lost almost 16 milliliters of blood per kilogram of body weight. TXA alone brought that down a little bit, to 14. But the combined therapy? Whoa! It slashed blood loss all the way down to 9.6. That is a massive, massive improvement. By patching up the vessel walls and shielding the clot, they did something neither drug could ever do alone.
So, what is the big takeaway here? We've got these two really elegant drugs with two completely different game plans. TXA protects the clot. Ethamsylate strengthens the vessel. And understanding the why, the root cause of the bleeding, is absolutely crucial for picking the right tool. But the most powerful lesson of all? Sometimes these different approaches don't compete. They complete each other.
It really makes you think, doesn't it? In medicine, we often search for that one single best solution, that one magic bullet. But maybe this shows that the real superpower isn't a single hero, but an amazing team,